are studying, sleeping, or exercising, all of our daily activities involve breathing, from the first breath at birth till our last. Breathing is the basic characteristic of life. But how does a simple inhaling and exhaling affect our body? And why is this so important? In this video, we will discuss the respiratory system, the parts, and its functions.
Respiratory system. Respiratory system is an oxygen supplier, elimination of carbon dioxide during inhalation, gas exchange, a passageway, and humidifier. It purify or humidify the warm upcoming air. The process of respiration will begin in pulmonary ventilation, which is commonly referred as breathing. It is the process of air flowing into the lungs during inspiration or inhalation and out of the lungs during expiration or exhalation. And in the exchange of oxygen and carbon dioxide between lungs and blood, during the gas exchange, oxygen moves from the lungs to the bloodstream, and at the same time, the carbon dioxide passes from the blood to the lungs. And the third process is the transport of oxygen and carbon dioxide in the blood. In here, the inhaled oxygen moves from the alveoli to the blood in capillaries, and the oxygen moves from the blood in capillaries to the air in alveoli. And the last process is the exchange of oxygen and carbon dioxide between the blood and tissue. On this, the blood transports the oxygen to and from the tissue, and the exchange of gases between the blood and tissue is called internal respiration. And now, let's go on to the function of respiratory system. Its function is to regulate the blood pH. The pulmonary system adjusts the pH using carbon dioxide upon expiration or exhalation, and then the voice production. The vocal folds produce the sound when they come together, and they vibrate as air passes through them during exhalation of air from the lungs. And the part that's responsible for voice production is larynx. And next is olfaction. It is the bodily structure that serves as sense of smell. It is the entrance of respiratory tract located in nose. And then lastly, the innate immunity. It defends the airspace from the array of macrobacterial production that enters the lungs on daily basis. And now, let's go on to the anatomy of respiratory system. The anatomy of respiratory system has two divisions, the upper respiratory tract, which is the nose, pharynx, and larynx, and the lower respiratory tract, which is the trachea, bronchi, and lungs. The nose is the opening of your respiratory tract. It lets the air in, it's visible, and it's composed of hyaline cartilage. And now the structure of respiratory system. First is nostrils or nares, the external opening to the nasal cavity that located on face. The connae is the posterior nasal aperture separated by vomer. It is the opening between nasal cavity and pharynx. The nasal septum is the wall in the middle of nasal respiratory cavity and the partition dividing nasal into right and left part. And the hard palate, it provides space from the tongue to move freely and supplies a rigid floor for the nasal cavity. Concave is the bony ridge on each side of nasal cavity. It increases the surface of area of nasal cavity, and it causes air to churn to be cleansed, humidified, and be warmed. Paranasal sinuses, the air lift spaces between bone and opening into nasal cavity or resonation chambers. It reduces weight of skulls, it produces mucus, and it influences the quality of voice. And then lastly, nasolacrimal ducts. It is open into nasal cavity and it carries tears from eyes.
Sneeze reflex. Sneezation is a term coined to refer to the medical condition originally termed stomach sneeze reflex, which is characterized by uncontrollable bursts of sneezing brought on by fullness of the stomach, typically immediately after a large meal. A sneeze or sternutation is expulsion of air from the lungs through the nose and mouth, most commonly caused by the irritation of the nasal mucosa. The purpose of sneeze reflex is to expel the irritants. The anterior ethmoidal nerve, or AEN, provides sensory branches to the nasal mucosa and plays an essential role in triggering sneezes.
Pharynx is a common passageway of both respiratory and digestive system. Pharynx is divided into three parts: nasopharynx, oropharynx, and laryngopharynx. The main function of the pharynx is to carry the air, food, and fluid down from the nose and mouth. And on the other hand, larynx. Larynx is also known as the voice box. The main function of the larynx is to protect the lower respiratory tract from aspirating food into the trachea while breathing.
Folds or vocal cords. The parts of the vocal folds or vocal cords, the thyroarytenoid muscle, deep lamina propria, intermediate lamina propria, superficial lamina propria, and the squamous epithelium. The function of the vocal folds: to protect the airway from choking on material in the throat, to regulate the flow of air into our lungs, the production of sound used to speech. How it works. Vocal cords. The vocal cords work as small bands of muscle and other tissues inside the voice box or larynx. This is what makes the sound. The parts of trachea or windpipe. The trachea has two parts: cervical trachea in your neck, thoracic trachea in your chest. The function of trachea or windpipe. Your trachea's main function is to carry air in and out of your lungs. How it works of trachea windpipe. The main airway to the lungs. It divides into the right and left bronchi at the level of the fifth thoracic vertebra, channeling air to the right or left lung. The cough reflex parts. Cough reflex has five components: cough receptor, afferent nerves, upwardly defined cough center, efferent nerves, effector muscles. The function of cough reflex. Coughing is an important defensive reflex that enhances clearance of secretions and particulates from the airways and protects from aspiration of foreign materials. Works of cough reflex. Each cough occurs through the stimulation of a complex reflex arcs.
So lungs is a principal organ in respiration. It is cone-shaped with its base resting on diaphragm and apex extending superiorly to a point about 2.5 cm above the clavicle. Bronchopulmonary segments is a division of each lobe which separated from one another by connective tissue septa. Bronchial tree is a main bronchi, and alveoli is a small air-filled chambers where the air and blood come into close contact with each other. Pleural cavities as spaces around each lung. It lined with a serous membrane called pleura that consists of parietal pleura. Lines thoracic cavity. And visceral pleura is covers lung surface. It contains pleural fluid that perform two functions.
Physical principles in airflow into and out of lungs. Changes in volume result in changes in pressure. Air flows from an area of higher pressure to an area of lower pressure. Lung recoil. Tendency for an expanded lung to decrease in size during quiet expiration. Factors that keep in the lungs from collapsing. Surfactant, pleural pressure. Spirometry. Spirometry process of measuring volumes of air that move into and out of respiratory system. Spirometer, the device that measures these respiratory volumes. For respiratory volumes: tidal volume, inspiratory reserve volume, expiratory reserve volume, residual volume. Respiratory capacities, sums of two or more respiratory volumes, total volume of air contained ranges from 4 to 6. Functional residual capacity, inspiratory capacity, vital capacity, total lung capacity, forced expiratory vital capacity, rate at which lung volume changes during direct measurement of vital capacity.